Hello, Dr. James Chestnut here. I'm providing a little bit of a background, I guess, or perhaps a little bit of a teaser, as we call it, for my upcoming seminar March 21st, 22nd in Denmark, on behalf of Chiroform, who are been generous enough to bring me into Denmark. I've never been, so I'm really looking forward to seeing the country and the surrounding countries as well, and really looking forward to actually having, I hope to be an intellectual, evidence-based, non-emotional, very friendly and stimulating presentation and discussion with the attendees. What I'm going to be talking about is, in a large picture, is evidence-based practice in the chiropractic profession or the chiropractic scope. So again, I understand fully that chiropractic is a profession, and then of course what determines whether we're evidence-based or not is the level of evidence we have for the interventions we utilize in practice. So before we can have an evidence-based discussion, we first have to become familiar with what the evidence says. So I'll start off with just a summary of the evidence for the interventions within the scope of chiropractic, and I think also, since there's a lot of discussion now about EPIC, evidence-based, patient-centered, integrative, and collaborative, that I think we need to now understand that it's our ethical and professional responsibility to also be aware of the level of evidence for alternative interventions for our patients that come in with spinal health problems or neuromusculoskeletal health problems. So I think one of the things that's really important to me is that we understand that being evidence-based and being patient-centric should be seen as being in an indissoluble union. In other words, being patient-centric means that we would utilize those interventions which have been shown in the peer-reviewed literature with valid research to have the best statistical chance to produce a good outcome for our patients. That is being patient-centric. So we can't separate being evidence-based and being patient-centric. However, when we start to look at being integrative and collaborative, which I fully support, what we can't do is presuppose that being integrative and collaborative represents being evidence-based or patient-centric. That's not true. They are not in an indissoluble union, because in order to be evidence-based and patient-centric, we should be aware and only integrate and collaborate with those practitioners who are using interventions which are in fact evidence-based. It is not being patient-centric or evidence-based to refer our patients out or to collaborate with people who are utilizing interventions that may not be safe or effective for our patients. So that therefore makes us, increases our responsibility to be aware of the level of evidence for any intervention we may refer out to as well. So I think that's an important discussion to have. The other thing I think that's really important, if we look at, and I think most could agree that probably the within the chiropractic scope of practice, certainly the most evidence-based intervention we have to date is chiropractic SMT or an adjustment. So I think it's important that we look at what are the clinical indicators for suggesting the need for a patient to receive chiropractic adjustment or SMT. What do those clinical indicators actually represent in terms of what's going on physiologically in that human being? What do we think that is going on in terms of physiology and anatomy and all those other kind of interesting things? And if there is this segmental problem that we're addressing with a chiropractic SMT or adjustment, and there's clinical indicators for that, what does the available evidence tell us regarding what are the neurophysiological, biomechanical or neurobiomechanical and structural effects of chiropractic adjustment? So I think it's also important to separate some of the literature that looks at a single chiropractic adjustment versus a course of chiropractic care, and so we'll discuss that a little bit. I often use the example of my background is exercise physiology. I have a graduate degree in exercise physiology, so I would always very often say to people, if we looked at the effects of a single bout of exercise, we would certainly recommend against it, because the effects of a single bout of exercise are actually quite negative. Changes in cortisol, breaking down tissue, etc. But if we look at the effects of a course of bouts of exercise, then it becomes very positive. So I'm not suggesting that's always the case with SMT or adjustment, but it's very important that we look at the difference between those things. And so I think it's important that chiropractors understand the physiological effects of their intervention. So that's important. My ultimate goal, I think, is to first of all have a rational discussion and based on the evidence, because I believe wholeheartedly that it's the evidence, which is really an objective way to unify the profession. The evidence is what the evidence is. So when we take the emotion and the dogma and the politics out of it all, we just look at what the evidence suggests, clinical direction that the evidence suggests we take, I think we find that we have much more in common than we have to argue about. And I think that to me is what's exciting about an evidence-based movement in healthcare in general, but certainly in chiropractic, because I think the more that we move towards an evidence-based model, I think first of all, the better it is for chiropractic, because I think we do quite well against other interventions in terms of chiropractic SMT or adjustment. And I also think that if we really look at history and what the record has been for the care of patients with low back pain or spinal problems, I think we could all agree, well, we would certainly all agree if we've read the literature, that it's been an unmitigated disaster. And I think that if you look at a fair interpretation of the evidence, I think that you would suggest, whether we look at what insurance companies are now doing, or we look at some of just the clinical evidence, I think that had people had more exposure to chiropractic and less exposure to surgeries and drugs and injections, I think we could all agree, if we're reasonable, that people would have been better off, and I think that will be true moving forward as well. So I hope that people come away feeling positive about the level of evidence for chiropractic in terms of effectiveness, cost effectiveness, and safety. So again, thank you to Chiroform for bringing me. This has probably been too long as a teaser, but I look forward to seeing everybody, and really looking forward to seeing Denmark and the other Scandinavian countries. It's been on my bucket list for a long time. Thank you. See you soon.